types of shock that we're going to talk about are hemorrhagic and non-hemorrhagic, both of which fall into the category of hypovolemic. Okay? Hypovolemic shock. What does hypovolemic mean?
Low volume.
It literally means low blood volume. Right? Emic, volume, low.
Okay.
Okay, so the first type of hypovolemic shock that we're going to talk about is hemorrhagic. What does hemorrhagic mean?
You're bleeding out.
Yeah, it means that you have low blood volume due to a loss of blood. It's pretty self-explanatory, right? You have a low blood volume due to a loss of blood. If it wasn't so yucky outside, I'd go outside and I'd show you how much blood a person can lose before they're considered to have lost too much. Okay, but it's yucky outside and it's not going to work right if I take you out there to dump it anyway. Sorry.
You should try it.
Yeah. I should turn the parking lot into a skating rink. Okay, so hemorrhagic, pardon?
You could do it on the grass.
You won't be able to see it.
Why?
It's water.
You need a flat surface because it needs to be able to spread.
It needs to spread. Yeah.
So how
I could
big,
do it in here, but then you guys would have to clean up.
how big of a puddle?
It's a pretty big puddle.
Big.
Yeah, well, it spreads out, so it would probably be this big.
Well, that's about a 6-foot circle, 6 foot in diameter.
Yeah. All right, so hemorrhagic is a loss of blood. Not a loss of blood from a paper cut, right? But it's a sudden and severe loss of blood. Okay. The other type of hypovolemic shock that a person can experience is non-hemorrhagic. What can cause non-hemorrhagic hypovolemic shock?
When you're losing fluids, which is to say vomiting or diarrhea.
Okay, we have a loss of fluids.
Would dehydration fall into that?
What else?
Burns.
Burns. What happens when somebody gets burned?
The cellular walls are damaged or destroyed, and therefore the fluid just leaks out of them.
Okay, the cellular walls are damaged or destroyed, so fluid leaks out of those cells. But other cells send fluid to that area to try and cushion and protect it. You've all burned your finger at some point and gotten a blister, or had a bad enough sunburn that it blistered. That's your body trying to protect the area where it's burned. So if you have a severe burn, your body's going to shove as much fluid as it can to that burned area to try and protect it. Okay? So burns can also cause non-hemorrhagic shock. Non-hemorrhagic hypovolemic shock. Okay? Is the fluid that comes to the surface of the skin when there's a burn, is that blood?
It's plasma.
It's plasma. So it's part of blood. Doesn't look a whole lot like blood. It's not red. It's clear or light yellow in color, right? But it comes to the surface to protect it, and that plasma comes from your blood. Okay, this is shock. Every patient you ever see will die of some type of shock. No joke.
But what if they don't die?
At some point, your patient will die, and it will be of some type of shock.
Something will fail.
Okay?
Unless you're the Highlander.
If a person is blown up in an explosion, they died of shock. Hypovolemic shock, hemorrhagic hypovolemic shock, really, 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 really quickly, suddenly and severely. Right? Okay. It's important that you learn the differences between the different types of shock, not because you as EMTs are going to treat them any differently, although you might. What do you have in your toolbox to help reverse anaphylactic shock? An EpiPen. Okay? What do you have in your toolbox to help fight the effects of cardiogenic or obstructive shock, or any of these types of shock?
Oxygen.
Oxygen. What are you going to use? What tool are you going to use to help fight obstructive shock? Not oxygen, but what tool? Bag valve mask. Yeah, why are we going to use a bag valve mask for obstructive shock?
It's got to keep the person breathing.
Got to keep the person breathing. We may need to use a bag valve mask for anaphylactic shock. Who knows? But that tool is there for you to use in order to fight shock. Okay? This is cool to me. I like this. I have a 20-year-old daughter who's going to be experiencing some type of shock here in the near future. All right, questions about any of these types of shock? No? We're ready to take the quiz right now.
No.
It's fresh in my mind.
I thought you said you were going to talk about the progression.
I am.
You missed one thing on non-hemorrhagic shock, and that's crushing injuries.
Crushing injuries. Why do crushing injuries fall into non-hemorrhagic shock?
For the same reason that burns do. You've got damage to the tissue, and therefore the cells can't retain their fluids.
And what do we see from crush injuries?
You may have loss of blood, and you may have loss of fluids.
We may have loss of blood and we may have loss of fluid. This crush injury oftentimes results in compartment syndrome.
What's that? By
It's where that
definition.
fluid collection happens within a confined space. So, compartment syndrome happens if you have crush injury to the leg. You'll have all that fluid collected in here with nowhere to go. And so it will prevent blood from passing through here easily because it's all swollen and full of fluid. That's why in a lot of crush injuries, when they're waiting for their patient to heal, they'll put a wound vac on there to help suck the fluid out so it doesn't cause that injury to be swollen.
One of my clients has one of those.
All right, go ahead and press pause, or stop, or whatever button it is you push back there.